Great pleasure to introduce Dr. Tingsong Lim. Dr. Lim, he wants to share his formidable experience on how to treat the visceral fat with Redustim and how he combined it with other body contouring devices to achieve the best results without any surgery. Dr. Tingsong is the medical director of Click Clinic in Kuala Lumpur. He's a worldwide key opinion leader in axial facial and body aesthetics. So actually he's behind a very nice concept, what he called it, the SSTF. It's slim, sculpt, tone, and firm. I encourage you to post any question you might to ask. So you can post your question on the Q&A box and the answers will be given to you at the end of the webinar. Enjoy our biosimilology webinar and over to you, Dr. Tingsong.
Thank you so much. All right. Thank you for joining this webinar. I want this to be more as interactive as possible. Feel free to ask any questions you have. Stop me in between if you want to. Just text, send a message so we can actually discuss it thoroughly. So I think it's great that you are interested in this device. I think in the past, we never had such a device that can target this particular fat. And we know that when we look at fats, I personally love playing with fat. I have a lot of devices that does fat. The earliest ones was cool sculpting. We come in to target subcutaneous fat. But we know that fat itself is not just stuck with one area. It's a totality. The reason why we have fat is a physiological so-called tissues that basically help us to store energy. And when we take in energy, the extra energy is converted into our fat cells to enable us to sort of store the energy whenever we need them, especially in early days that we don't get to have food every day. So that's where we actually store them. And the storage basically is stored in the visceral area, inside our organs, and also at the subcutaneous area. And these are areas that we generally can know if someone has extra storage. But the problem is, if we actually store more than what we have, it might actually be somewhat of a harm to the body. Just like what happened right now when we have too much oil, when everybody wants to dump them, then it's an excessive. And the excessive fat doesn't mean that the body will throw it away. It actually stores in a form that can cause more harm to the body. We call it lipotoxicity. That means when you actually have no much area that you can store inside your subcutaneous area, and then it starts to grow more and more in the visceral area, and then you can actually have a lot of this fats stuck in your liver, stuck in your in the muscles, and this causes a lot of inflammation of the body. It also creates something what we call the insulin resistance. When you have insulin resistance, that means the body trying not to take in any form of energy anymore. Then the body is filled with a lot of different, high glucose, a lot of fat in there, and then it actually creates a lot of microcirculation issues and continuous inflammation that shuts down the body and make the organs and our tissues in a very inflamed form, which I will tell you what kind of consequences it will bring. Of course, when we look at a person, that when they have more visceral fat in their body, we know that they are in a higher risk of getting a lot of chronic diseases, and in terms of longevity, it is not a good thing, because the visceral fat is the most dangerous fat in the body. When we look into people with high visceral fat, with visceral obesity, they are more their chances of getting the hypertriglyceridemia as well as the bad cholesterol is much higher, which also links into a lot more of this people has hypertension, high blood pressure as well as type 2 diabetes based on what we know earlier. And these are all studies that shows that patients who generally have that has more issues in terms of getting non-alcoholic fatty liver disease, cancers, insulin resistance, heart diseases, dementia, stroke, and polycystic ovarian syndrome. So it not only affects you in terms of functional longevity of a person, but it also creates a lot of functional disability in terms of this long-term effect. And one of it is the hormonal changes and the changes inside the organs that we see with polycystic ovarian syndrome. That you see people who has higher BMIs, they generally will fall into this trap where they have end ovulation and female infertility due to this polycystic ovarian syndrome. And they also have a lot of changes in terms of their so-called sex organs. And we also see that people who has non-alcoholic fatty liver disease, in long term, you can have a lot of liver issues. And we know that is one organ that plays a big part in terms of trying to get rid of toxins from the body. And when we look at people with high levels of fat tissues in there or overweight, they generally develop fatty liver, and then their liver fail continuously, and other end organs also went to problem. That's why in the past, we always want to find something that we can tackle, especially on the visceral fat. The early 2000 or 1998, when we have cool sculpting came out and looking at, we can take away the subcutaneous fat non-invasively. It sort of changes how we look into playing with fat cells, especially stubborn fat cells that is resistant to diet and exercise. But when we talk about visceral fat, we need something. We all in the past we only rely on diet and exercise. But the problem with diet and exercise is not a lot of people can do it in a very effective ways, especially those who actually go through a yo-yo lifestyle. That means early days where they get a little bit more overweight, they go through very strict diet and then they go on diet and then certain exercise, they bounce back. When you're younger, it's easier. But you realize a few more times of doing that yo-yo lifestyle, the fat becomes more and more resistant. And then there's a much more threshold before you can get rid of this visceral fat. And when this device came out, it actually is very interesting because never before we have a device that could increase your ATPase activity and create that kind of induction of 5 to 10% of increase of energy use. And this is something that is done in Columbia University, where I look into how this will increase 5 to 10% of your ATPase activities by stimulating the using the magnetic field to open up your calcium channels and stimulate your calcium release to from the sarcoplasmic reticulum to induce your muscle contraction. And what we know is by doing so, you are using about 10 ATP molecules per second of energy, which induce you to use up that energy. And in a way, it helps you to burn more fat. And what we see with that is different from what we've seen in other modern modalities using pulse magnetic field, is to actually sort of give you more of the muscle movement towards your superficial muscle groups and contraction in such a way. Of course, that helps as well. But this is a different device where it uses low energy and low frequency, where you actually can tuck deeper towards where the organs are. And this is where it gets interesting, because we've shown that earlier, what I've shown earlier in terms of what Columbia University did was they look into, by using this magnetic field, you can actually have that 5 to 10% of increase in ATPase activities. And by doing so, you also create stimulate the hydrolysis of the intramuscular triglycerides, and using all the fats that is being stored in your visceral by increasing the what we call the hormone sensitive lipase activities. And these are things that where we can actually induce that to use your energy in the organs that you can actually sort of take it away. And in that, you also reduce the amount of the fat storage there that actually leads to what we call the lipotoxicity in the end. So there's a lot of studies that done that shows the efficacy of this device. One of it is by Dr. Bernadette Carpentier that shows that by doing so, he actually managed to gather about 20 volunteers, 12 females, 8 males, and there's average about 8% of visceral fat reduction in all the subjects they see. And surprisingly, he also did some sort of study in terms of the liver function test, and he actually showed that on average, the patient lost about 17 to 18% in terms of the liver function test for those who have what we call fatty liver problems. And this is from the 20 patients that he gathered. And when you look at the overall visceral body fat, that's about 8% of reduction. And they also look into their blood pressure, that's about 9% of reduction. And these are the blood tests. On average, you can see the reduction is there. That means the fatty liver actually improved after doing this. That means this, by using this low frequency, low energy, what we call the magnetic field, you can actually stimulate the body to get rid of extra fat tissues or fat storage that gives the body a sense of a rest from all this inflammation that's ongoing. So we talk back about ATPase activities that actually induce more energy use, particularly in all this around the organs. So it's more than 20 years of clinical research. There's a lot of white papers that's out there. If you are interested, you can always get from EMAT. But one thing that also is very, very interesting, especially for me, is when they actually did a study to look into how the body uses the energy from whether it's from your glucose, from your carbohydrates, or from your fat. That's where the key play of this, this device is that we actually can switch the body to utilize energy from certain particular place. And this study is done in Amsterdam, in the Netherlands, that they bring in subjects and after an overnight fasting. And what they did was they actually measure the basal metabolic rate, about 35 minutes of it. And then they give them about 10 minutes break, and then they gave them a light meal. And after that, what they did was they actually had the subjects over the Redustim treatments, and then after that, they bring the subjects back and retest them to actually get their energy expenditure. And what they actually measure this time is look at whether the energy is being used in terms of their metabolism, is whether they are using the fat, the ratio between whether they are using the energy from the fat or the carbohydrate. And it's interesting enough, when they actually do a baseline, they look into the baseline of the metabolism, and then after that, when they look into after using Redustim, and there are changes. The changes is very interesting because in a natural condition, in a natural metabolism, we actually tend to use more carbohydrate oxidation compared to fat oxidation, as you can see here. But right after the treatments, you realize with Redustim, the carbohydrate oxidation, comparing to the fat oxidation, it become that the carbohydrate oxidation drop, whereas the fat oxidation increase in that sense. That means the body is using the fat as a source of energy right after you treat it with Redustim. And this is interesting because lots of time when we go through diet and exercise, and if we actually do too much, like if we starve ourselves for too long, or if we go through very, very rigorous exercise, the body lose a lot of glucose. And what we see is what we call a hypoglycemic attack. And in that sense, people actually sort of need more sugar to kind of retain to remain able to do their daily activities. And with this, you can actually switch the body to actually utilize fat even more. And in that sense, I find it very interesting because it switches the body to use more of your storage that is an excessive. And especially those who has been through a yo-yo lifestyle, like I say, when you actually go through the yo-yo kind of lifestyle that your fat cells become more resistant to give out energy, this actually switches the body to reutilize the fat cells, the fat energy again. And this has sort of trained the body to use it up. And that's how I show you some of the before and after that we've seen with our clinical application of this device, that we see a lot of changes to those who have been through a lifestyle that have gone through that yo-yo, where they actually have weight gain, weight loss, weight gain, weight loss for multiple times. And what we are expecting to have in Q4 of this year is look into this study done by Gabriel Brenda, doctor, that to look at the efficacy of Redustim treatments in terms of reduction of waistline, visceral fat, and fatty liver as well. So I think some of you have already had that device. If not, it looks something like this. They have several different types, but this is major one that has a magnetic field and also a micro pressure that comes with it. So when the magnetic field is playing, there's also at the same time a bit of massage going. It's somewhat like going through a spa. So you feed yourself in there like a Austrian suit that you can just lie down. A lot of people, when they go through that, it's very relaxing. It's really going to spa. I've tried myself. I love it. And you actually, because of that magnetic field, you actually get a bit sleepy. And some of our patients actually kind of slept through the treatments, and some even snore. But it's that relaxing. So there's no pain, no discomfort. Basically, you just put yourself in there, a suit, and you kind of like let the device do the work. So, so there are certain protocols that we follow, especially for people who tend to have to, when they come in at a certain period of time. And we know that right after treatments, we generally take them, request them to be fasting or not taking any carbohydrates for 4 hours. They can still drink water, but not sugary drinks. But before that, if they feel that 4 hours is difficult to go through, because some of them might get hungry after the treatments, what we ask them is to take light meals 1 to 2 hours before the treatment. And of course, this is not a solution for you to replace your healthy lifestyle. This is not your shortcut. What we see this device is an add-on, and it's a tool for people to reset their lifestyles. And what people, when they come in, they start the treatments as well as they remodel their lifestyle a little bit. Most of them already in a quite a healthy lifestyle, but basically it's just fats that's too stubborn to get rid of. So they go through these reducing treatments to help them to achieve what they want. And of course, we also look into what the BMI is. And of course, the bigger BMI, we definitely need more treatments. You can go up to 18 or 24 treatments if needed. But generally, the key is about 12 treatments is sufficient to do a lot of work. So I personally started off with cool sculpting, and we have the sculpture and also the True Sculpt ID. We are big in body. So one thing is I can treat the subcutaneous fat very effectively because I have all these FDA approved devices. But the problem is we always get patients when come in, is not only subcutaneous fat, it also has visceral component of it. And in the past, we always get them into diet and exercise, but sometimes it's insufficient. And that's where Redustim comes in. It helps us a lot in terms of getting even better results by combining them. So how you can combine them is when you do cryolipolysis, we generate about 2 to 3 days before we start the cryolipolysis, after the cryolipolysis treatments, and then we can start them on Redustim. Or sometimes you can even start them on certain Redustim first, and then in between you do your fat reduction, non-invasive fat reduction. But if it's cool sculpting, rest about 2 to 3 days before you start the next Redustim. If it's radio frequency or laser like hyperthermic lipolysis, such as sculpture, you can do it on the same day as well. So these are some of the results by using Redustim on its own. This is results from Japan, a 34-year-old gentleman. As you can see, the reduction there is almost 3 liters of volume reduction and 9 centimeters of waistline reduction. And look at the results. It's fantastic. And what we see by taking away that visceral fat, you can see some of them actually retain a quite nice body figure. And what we also see is when you have more volume onto visceral fat, it actually pulls the skin down and actually place it very heavily, almost like as if they are pregnant. When you take that fat away, you see how much of that reduction sees, and it actually definitely gives someone looks in terms of body figure a much better outlook. So this is another 65-year-old gentleman from Japan as well. As you can see, a reduction of 2 liters and the waistline reduction about 7 centimeters. And this is how, when you actually take the scan and look into the visceral fat, in terms of that, the first line is the overall. Zentai means the overall body shape, and you can see the volume in terms of reduction is there. But the one that we are looking into is Nizo, which is the internal organs. And the visceral fat here reduced about 20 centimeters square. That's quite a lot. And you look at, and what we also look into is, this is another subject, a female which is 48 years old, and you can see a reduction about 2 liters and a reduction in terms of waistline of 6 centimeters. And again, this kind of visceral fat, when it's too in there, a lot of ladies will actually be sort of misunderstood as being pregnant, which is not a very good thing. So basically, what we see here, the reduction is actually quite significant. It's about 60 centimeter squares of the visceral volume that is lost there. So you can see how effective it is. This is another gentleman from Japan, 46 years old. Again, the reduction is about 3 liters. The body shape improved tremendously once you take it there. So this is quite amazing, where you look into how all these improvements are there. These are some of the studies from Asia as well. This is from Korea. This patient has a reduction that you can see. So basically, this is the baseline, where we see about 222 centimeters square of visceral fat. When after the treatments, you can see that is it drops down to 166. It's about 25% reduction. And so this is another one that you can see that changes with time. So from 53 centimeter square of visceral fat, you can see that reduction to about 45. And these are some of the before afters. You can see that from 31, it changes to 27. And we have seen how it actually improved in terms of all sorts of measurements. So these are some of the before and afters from our own clinic. As you can see, this patient that has, so of course, this is after 12 times, and of course there are more rooms for improvement. But if you look at how the visceral fat has improved in terms of it's not as bulging, and one of the things that we also see in terms of patients who come in and did this is that they feel that they can breathe better because the visceral fat is not pushing the lungs up, and they feel better about themselves. They feel more energetic because they can actually breathe better. There's more oxygenation. And also look at the skin quality that has improved. We've seen a lot of skin quality improve in terms of that because there's less inflammation in the body. These are some of before and afters. Again, the overall reduction is visceral fat plus some of the subcutaneous fat as well. And you can see how the skin quality, like this lady, because of the inflammation of the body, she has a lot of skin issue. It's a lot of irritation around the skin, but once you've done it, the skin quality improves. So we know that by reducing visceral fat, you can also help the body to become healthier, and the bulges are not so apparent. But of course, if you ask me, there's still more treatments need to be done. These are early days when we look at how much we can improve by using 12 sessions. So this is one of the photo I just got this morning. I just added in. It's because when I was discussing, when one of the doctors was telling me, this is a photo from a doctor from Singapore, and he did 12 times. After the 12 times treatment, there's reduction, and he swear by this because he's like, never before he get such a treatment, even without an exercise, and he couldn't really get this, and actually after Redustim, you can see that improvement. Of course, in our practice, these are common things that we add on for those who actually have difficulties reducing that overall fat, especially the visceral fat. Is not just for the aesthetic outlook, but also for the overall health of a patient. And again, one thing I really have to sort of point out is how much of skin quality changes that you will see because less of inflammation that's in our patients. But of course, because we are a practice that has been doing fat for some time with non-invasive subcutaneous fat reduction, we actually combine it together with our devices such as cool sculpting, and this you can see how we can improve the results by adding Redustim to our non-invasive fat reduction. You can actually gain better results and more satisfied patient because of that. Of course, when you take away visceral fat and at the same time you take away the amount of subcutaneous fat for them, it actually gives them a lot of confidence in terms of your treatments and improvements in terms of overall outlook. So we also combine with other modalities, not just cool sculpting. We also combine with sculpture. You can see that, especially on the lower part, you can see how much improvements are there. And there are skin quality changes as well, and certain bulges that you can actually target. We also had patients, doctors, family members that came in and did treatments. At the same time, we did some blood tests to see how much we can improve. And she has fatty liver problem. And when we took before and after the treatments sessions, we realized that there's a normalization in terms of liver function tests. So these are things that we do see with our patients. And recently, there's a lot of talks about coronavirus. I think some of you or most of you are actually in the lockdown, just like myself, that because of COVID-19. And recently, there's also a very interesting article talking about how overweight people actually tend to get into trouble with COVID-19, and then they are more vulnerable to the coronavirus. And when we look at the ICNARC reports that came out from when the patients in critical care or ICU, they realized that these patients that they gather from the ICUs or intensive cares, they realized that the amount of patients who actually went into more critical conditions, about 70% of them are obese or overweight. That means in a very simple form, that means you are more likely to get a severe or more serious condition out of COVID-19 or any kind of coronavirus infection when you are more overweight. So in that sense, to protect yourself, that means you are better off being slimmer and sort of maintain a normal weight. So what we see is what happened when they see that is that not only we are taking people who are in a more vulnerable group, such as the elderly, to ask them to go into quarantine or so self-isolation. Now we also have to take those who are higher BMIs to actually self-isolate. So because they are on higher risk to get severe coronavirus infection. So why is obesity a risk factor? So basically just now we talked about when you have more visceral fats, it actually sort of stuff out the internal organs and push your lungs upwards. That means your lung doesn't have enough space to expand. People who are actually chronically that, I don't know whether you have any patients or any friends or family members that is morbidly obese, they are always breathing heavily because their lung capacity is not sufficient to pump up enough oxygen to all the organs. They are constantly puffing and breathing heavily. So in that sense, because they do not have enough lung capacity and because of reduced lung volumes due to the lots of visceral fat in there. The other thing that we also know is that when you have a lot of this, the body tends to be more inflamed. When they look at the immune cell types in people who are more obese, is that you tend to have more inflammatory cell markers. That means people who are in that particular condition, that their body is constantly inflamed. And we know that when we see a lot of mortality with coronavirus, is that there's this term called cytokine storm. That's why a lot of cases that people are discussing these days is there's a lot of micro thrombosis that's going on. There's a collapse of the peripheral vasculature. It's because there's a lot of cytokines that are running around. And when someone is already readily inflamed, chronically inflamed inside their body, it's much easier to trigger that cytokine storm into a much worse condition. And we know that that is one of the risk factors. That's why in terms of risk, I think it is better to have a normal or under sort of BMI that is healthier to sort of get your risk down. So in that sense, we also kind of look into right after or during this COVID-19 period, perhaps we should get more of our patients to actually reduce their overall visceral fat to actually help them to not to go into this serious condition after COVID-19 infection. So in other words, I think what we see with this device is something really interesting in terms of, like I say, switching the body to use fat as your energy source. And the other thing is to reduce inflammation in the body. And I think in the next few years to come, we'll see more and more studies to look into how by changing the body fat and the visceral fats in the body, you will see that there's a lot of hormonal improvements, body condition improvement, and that will actually lead to a healthier person in totality, not just on the aesthetic side. So with that, if ever you are free in August, we were running this conference. We're thinking about changing it into an e-form, that means a digital form. And I think if you are interested in it, you can always ask me or email about it. Thank you. With that, thank you very much. Stay safe, stay well.
Thank you, Dr. Tingsong. It was very, very interesting. We got many questions. So we will start with the first one that we got. First question, Dr. Tingsong. It's since Redustim acts directly on smooth muscles, have you noticed any activity on constipation? So
yes, that's
Redustim helps.
Yes,
yeah.
That's a very interesting question. Yeah. It also depends on the person. Like myself, I actually also did Redustim on myself. I have no changes in terms of bowel movements. I have my colleague who's a female doctor. She said every time she did a Redustim, she has a softer stool going on. We had did the same treatments, same energy levels, but she does see somewhat of the softer stool, but it's not diarrhea. It basically, what she said is that she has more bowel movements and she actually likes it because people who actually has constipation generally will see some relief with it. But it also has to depend on that person, how sensitive towards this device, and also how chronic or bad is their constipation. But I think in a way, you will see some of your patients who undergo it will tell you, oh, my constipation actually improved.
Thank you. Second question, what kind of patients is more common at your practice? The one who needs to be treated for disease or the one who just need to lose some weight?
Right. So in our practice, we generally see mostly people who come in for solutions, and there are some who look into trying to be aesthetically well, but there's a component of them is more towards wellness. They have been trying a lot of methods to trying to lose weight, but they couldn't. I think partially they want to look great, but also it's more for their health. So it's a combination when they come in, because it's a complex, and when they have actually tried a lot of things, they are actually desperate. And some have tried a lot of really out of this world treatments before, but never really get good results with it. So we do see quite a sort of a spectrum of them. But whenever I talk to them is, of course, the outlook is important, but I always emphasize that when we do this, we also have to look into a long-term plan, because what we want to achieve here is they can live functionally healthier in the years to come, and it has to be sustainable. This is more like a trigger point for them to kickstart with, so they can actually have a healthier lifestyle and healthier well-being on the years to come.
Okay, thank you. Other question, it's, do you see any patients who have had subcutaneous fat reduction with cryolipolysis and later experience an increase in VAT after the treatment and related to change in their lifestyle?
Yes, of course, when you actually do cryolipolysis, it's taking away the superficial layer of fat in the subcutaneous areas. it should not be a device that actually replace your healthy lifestyle and your diet and exercise. And if, of course, there are people who actually take it as a shortcut, and when they do so, when they take away the subcutaneous fat, when they eat a lot more, you definitely see increase, and of course, the fat in areas that you didn't take away, like your visceral fat. So these are patients that you generally want to put them on Redustim. And of course, like I say, it has to be a tool for us as a reset for changing in terms of lifestyle, and should not be like a shortcut.
Okay, thank you. Another question about the longevity of our devices. So we have one question about, so once we do a protocol of Redustim treatment, do people tend to regain weight rapidly? And same question related to the fatty liver disease. So I believe the question is that, like, if the patients go off the treatment after a while, or they need to do like any maintenance or any maintenance protocol?
That's a very good question. Like I say, this device does train your body to convert. Like, so when we look into how the basal metabolic rate changes after the treatments, and how the body uses the fat, but I don't think it's only temporary. It actually trains the body to switch the body to utilize fat energy in a different form. Because when you're, just like when we talk about when you exercise, when you build muscles, of course, if you don't do it for a long time, slowly the muscle will regress. But if you actually train it enough, it becomes a muscle there that actually stays for a longer time. Of course, you still need some maintenance, but if your lifestyle, it continues to be healthy, this, in terms of, if you do enough, your basal metabolic rate also increase. So the results can be a long-term thing. But having said that, if someone does it, I always ask them to do somewhat of a maintenance if possible, especially those with higher BMI. You can complete the 12 sessions, 18 sessions, or 24 sessions. And after that, if you want to continue to do somewhat of, you don't have to repeat that often, but somewhat of maintenance is helpful as well.
Okay, thank you. We have another very interesting question about the waistline measurement. So we know that visceral fat in abdominal area, it's in the stomach. So we can consider the results in this area. And when it comes to female patients, this person, he think that the visceral fat may move to down area, so more in the hips.
Right.
So is the abdomen area our main criteria to see the results, or we need to have other measurements for female patients?
Well, I think measurements, in terms of measurements, there's a few ways that can do it. We generally become more objective about it. I would not suggest doing just one. And with measurements, sometimes if you use the measurement tape, the way that we do it will be different from individuals to individuals. Even the same person to measure, the first day and the second day might be slightly different. So I always be very cautious when I look at the data. You have to do it in a more objective form. So you have to take it multiple times to see whether that's correct. I think photos are the ones that I generally rely a lot in terms of taking looking into it. But if you have nowadays, because there's a lot of the tools that you play with, like 3D cameras and stuff, it's easier to do this kind of measurements. But for females and for men, what I also see is the movements of soft tissue when you take away visceral fat is sometimes when you measure the upper layer, upper side and the lower side will be different, because sometimes as you deflate your visceral fat, what happens is the tissues that is being pushed up is no longer being pushed up, and because of decrease, they actually become smaller, so things start to move down. The upper layer, you will see that so much reduction, and the lower side, you might see not so much a reduction, because because of reduction in the internal organs, that you will start to see that most of the volume has moved downwards, and you don't really have so much of it on top. So then again, the measurement is important, but I will say you can create your own very objective measurements. Like one thing that is like someone is asking about, what about hips or thigh measurements? Because overall fat reduction can also reduce that. If you want to take, I'll say by all means take it. The more data you have, the more you can actually look at the whole angle more holistically and more 360.
Yeah, sure. And one question about it also, there is any cause of excess skin with Redustim? Did you see that with your patients, or it doesn't target the skin?
Yes. So with Redustim, if there's a lot of a huge reduction in terms of visceral organs, there will be those who are overstretched will see some sort of skin laxity issues. That's why we generally ask when we see, when we actually look at a person, when we treat body, we have to do the holistic part. So just now you mentioned about the SSTF. So it's how we look into body these days is no longer just look into one particular fat and that's about it. We look at how we want to improve the whole body shape in terms of slimming, which we have Redustim as one of the components to actually reduce the overall fat for the whole body, from the liver, from the visceral fats, and also some from the subcutaneous area. And then we have the Sculpt, which uses energy-based devices to take away pockets of fats that's resistant to diet and exercise in the subcutaneous areas. And after that, we also have to look into tone, which we have to increase the muscle tones on the superficial side. That means we can increase more skeletal muscles to actually improve the overall sort of energy consumption. And last but not least is to firm out the skin. So I do take firming of the skin part of my overall holistic approach to body.
Okay, thank you. And regarding this holistic approach, we have a question about radiofrequency systems. So this person, he's asking what do you recommend, like what radiofrequency system do you recommend to work side by side with Redustim? So any specific radiofrequency?
Yeah, I think there's a lot of radio frequency devices that's available out there. But I will say that as long as it works and as long as it's safe, I think you can use them. I personally have a few things that in my toolbox. I am more particular about my devices. I generally go for FDA approved devices or category changes devices that I use with it. So for body, in terms of tightening, improve the skin, we actually use the FDA approved device for fat reduction using radio frequency, and we do see skin quality changes with that. We also use something that combine radio frequency with some vacuum that it helps that so-called skin tone because of that. And we also use injectables as well as other energy-based devices such as ultrasound to help in terms of tightening. But I think as long as you actually have a device that works and safe, doesn't burn your patient, I think that is doable.
Thank you. And one other question again, because we still have like 10 minutes, so we will try to reply to, because we have a lot of questions.
Okay, sure.
I'm trying to take
Right.
many of them. And there is some clients that claim that they feel some weakness after the treatment. Did you notice that in your clinic? And it is a normal side effect?
What kind of weakness are we talking about? Do you know?
This person, she's saying that feel weakness, so like lazy or
Easy,
like some
Actually, the amount of the electromagnetic field is actually stimulating a lot of what we call it. It sort of it uses up the energy. That's one thing. It uses peristalsis. It actually creates some microcirculation that's going on. And I think that's why when we do that, a lot of people actually goes into that sleepy mode. They get sleepy. Some of them actually slept through, but when they actually slept and then we wake up after that, some of them actually become energetic, and some are still in that kind of zone phase. I do think that it actually sort of have certain waves that plays a part in inducing some sleep. And I think there is some sleeping hormones in that whole thing. I think you might later also tell us about that. But also because of the usage of the energy that's there, that actually sort of take some of the blood supply into that area. So you kind of get a little bit groggy after that. But this is not something that is permanent or long-lasting. If they actually set it up, they can actually go back to driving their cars, but it is like going to a spa or massage. Sometimes after that, you feel like, oh, I can really get a good sleep after that.
Exactly, thank you. We have another question of a Redustim user. So he's saying a lot of our patients love the results as well as the treatment itself.
That's good.
It is any maximum number of treatments recommended? Can we go for overdose Redustim?
I would not suggest doing overdose or Redustim. I think first, it's not cost effective unless they are very rich. You want to do that, but also we also talk about playing safe and being optimal about these treatments. And I do believe if you do 3 times a day, I think that's too much, and it might not give extra benefit. Sometimes if you stimulate too much, I don't think it's also good for the body as well. So I will say go on just enough, just like what we do with everything in life. You just want to do it just right. You don't want to overdo anything either. So I'll say 3 times a week should be fine. If someone who wants to have more expedited results, you can do it on daily. I probably won't do my patients on more than twice daily or more than once daily. And the thing about, you can actually extend the treatment time a little bit longer. You can set to about an hour. And that is probably the max I'll do for my patients right now for that.
Thank you. We have a nice question also because, now since like 2 years, we have other devices using magnetic field, but not the same as Redustim. So we have this question, is Redustim is helping to improve the muscles? I believe this question is more related to the skeletal muscles, so muscle growth.
Right.
So can you please give this difference between Redustim technology and other pulsed magnetic field like mSculpt or others?
Right. Yes. So we know there's in the market right now, it's a boom in terms of using electromagnetic field. So the difference between Redustim is that it's using low frequency, low power. You kind of target it more deeper into the visceral area, and you induce that is more kind of soft and natural kind of movement, without actually creating big excessive movements of the muscle. So in that sense, it's more natural. It's actually gentle, and actually you can target further into the soft tissue, into your smooth muscle in the deeper organs. Whereas most of the electromagnetic field devices that is using for building skeletal muscles, they are using higher energy, and their penetration is only more because of the high frequency they're using is generally on the superficial side. So you are targeting directly towards the muscles on top where you want to actually stimulate them, and you need higher energy to create that contraction that you want. So it's very different, but because I also have it, I do combine both of them, and it doesn't replace each other, and it doesn't contradict each other. In fact, in combination, I think it would also help in terms of getting better results as well.
Thank you, Doctor. Because it's this question we have it a lot, like with this people, they want to compare Redustim with mSculpt, so it's good to show them like it's completely different.
It's complementary rather than
exactly.
competition. Yeah.
And we have one question regarding this post-COVID situation. So for sure, like in 1 month maximum, all the clinics will be open. And we have this question: is it safe after this COVID-19 period to use body contouring devices, to use, for example, Redustim or anything? So what's your advice, and what's the regulation also in Asia are saying right now?
That's a very good question. Actually, earlier I was in another webinar. We also talked about that. So in fact, post-COVID, there will be some changes in terms of how we practice. We'll have more stringent screening, more stringent in terms of best practices that we do. But one of the things that we look into is what are the treatments that you can immediately jump into, and what are the things that we will roll out after a few weeks, looking at the situation, and those we want to push it for further. So when we talk about that, non-invasive, non-plumb, non-injecting things are the safest to start off with, because there's no direct contact. There's also a lot of, there's no sort of risk of transmission. And I think Redustim and also body contouring will be the first choice, because that is probably the easiest and the safest to jump into right away.
Exactly. This is what we do also at the company. Like we need to disinfect like the suit, and that's it, with the alcohol of 70 degrees, and it will be totally safe. And about this COVID situation, so we have another very important question for you, Dr. Tingsong. So it's a question more medical. So the question is, I have a strange question regarding the lungs. Patients with emphysema in the pulmonary pleura, can they do the treatments? Visceral fat somehow blocks the growth of emphysema and does not allow them to grow. What do you think about that?
Emphysema, okay. So you mean like patients who have emphysema and also pulmonary pleura, and you want to do Redustim?
Exactly. The question is that they can do the treatment because somehow the visceral fat is blocking the growth of emphysema.
Okay, right. Well, I think when you have someone with some chronic diseases, and if you also have someone who's in acute, I generally don't put them into this kind of treatments. I think most of them, of course, when you actually have overall sort of condition that you want to improve, I think you have to look into the importance of it. If this is not your first priority that you want to treat, I think treat those underlying condition that is playing a part. Like if someone has stroke or someone has heart disease, I will treat that first rather than jumping into this. And of course, this kind of patients, I think I will put it as Redustim. I will actually get their condition into a better form before I jump them into putting them into Redustim treatments. I hope that actually answered the question.
Thank you, doctor. Can we take the last question? It is okay for you because we still have like 1 minute. Thank you. And so regarding the combination protocol, so we have one question: if it's better to do the Redustim before or after the laser lipolysis, because we have many plastic surgeons, they are using Redustim with the liposuction because they can't treat the visceral fat with the liposuction. So they have this question: it is better to do it before or after the liposuction?
I think you can do it before, or you can do it after, and you can do it in between as well. That means if you are doing non-invasive fat reduction, like I say, you can start Redustim, and then in between you can do the non-invasive fat reduction, and then continues with the Redustim. So I think it all works depending on how you can actually plan the timing for your patients. And I think all of it works. especially for those who just finished their so-called non-invasive fat reduction or liposuction. If you want to put them on Redustim, that helps in terms of getting better results. Or those we think that taking that visceral fat away will definitely give you better results in terms of surgical or non-surgical. You can start off with Redustim and then do the treatment as well. I don't see that's a problem doing all this together.
Thank you, doctor. I think we have many other questions. So the other questions we can reply to you directly. We will send you an email with these questions. We have recorded also this webinar, so we will send it to all the attendees plus the visitors who couldn't attend this webinar. Thank you, Dr. Tingsong. It was a great presentation. We will do another one in Japanese because you speak Japanese. So
it'll be fun. Thank you so much, everybody, for joining this. And it's actually a great session. Hopefully, there's more questions to it. I think it's a great device. You all should actually look into it if you haven't. Generally, I think even without COVID-19, it's a really great device. But after COVID-19, I think this will be something that you might want to have in your practice, because you will see a lot of patients might not be so keen in doing something more invasive now. And this is something that is actually reasonable. It's safe, and then the efficacy is there, and you can help a lot of your patients who have been stuck at home for a very long time, and they kind of have trouble trying to get rid of some of the extra fat, and definitely this is a great solution for them.
Thank you, Dr. Tingsong. So stay safe and see you soon. Thank you.
All right, you too. Stay safe.
Thank you. Stay safe.
You.
Bye. Thank you. Bye.